SSRI drugs. Nausea and vomiting are two of the more common side effects of antidepressants, and it may take some time to get over these symptoms when first starting treatment. In fact, nausea is often cited as the #1 side effect of selective serotonin reuptake inhibitors SSRIs used to treat major depression and anxiety disorders. In some cases, nausea and vomiting can become so severe or persistent that a person has no other option but to stop treatment. Causes: nausea and vomiting are common side effects of many drugs. These symptoms are more often due to the effect a drug has on the central nervous system (CNS2) rather than any toxic effect it has on the stomach or gastrointestinal tract (GIT). The situation is slightly different with SSRI antidepressants. This class of drug works by stimulating the production of serotonin, a neurotransmitter associated with mood, cognition, and appetite. When serotonin levels increase under the influence of SSRIs, they stimulate serotonin receptors in the GIT as well as the brain. The combined stimulatory effect on both the GIT and CNS can trigger such side effects as nausea, vomiting, diarrhea, and the loss of appetite (anorexia). Antidepressant withdrawal. Antidepressants can also cause nausea and vomiting when treatment is stopped too suddenly. Known as antidepressant discontinuation syndrome or simply antidepressant withdrawal. The condition can cause an array of symptoms if the body is suddenly deprived of the drug. Gastrointestinal symptoms are among the most common and potentially severe. While antidepressant withdrawal symptoms are less intense than those associated with benzodiazepines, they can persist for several weeks and even lead to rebound depression, in which depressive symptoms return, sometimes worse than before. In addition to nausea and vomiting, antidepressant withdrawal can cause diarrhea, anxiety, fever, headaches, confusion, profuse sweating, tremors, dizziness, vivid dream, panic attacks, and even hallucinations. Risk by drug type. Research issued by the U.S. Food and Drug Administration suggests that the risk of SSRI-associated nausea ranges from significant to high. Paxil paroxetine 3.2 percent 4. Selective citalopram 4%. Lexapro-escitalopram 15%. Prozac fluoxetine 21 percent 5. Zoloft sertraline 26%. Luvox fluvoxamine 40%. This shouldn't suggest that nausea and vomiting only occur with SSRIs. The symptoms are also common with other classes of antidepressants, albeit less commonly or profoundly. These include tricyclic antidepressants TCAs, serotonin norepinephrine reuptake inhibitors SNRIs, and selective serotonin norepinephrine dopamine reuptake inhibitors SNDRIs, all of which increase serotonin availability in the blood. Nausea and vomiting are less common with the class of antidepressant known as monoamine oxidase inhibitors (MAOIs). The only exception is with MAOIs are stopped too abruptly, triggering withdrawal. Coping. In most cases, nausea and vomiting will develop soon after treatment is started and gradually resolve within 1 to 2 weeks once the body adapts to the medication. However, as many as 32% of people taking an SSRI will experience recurrent bouts for up to 3 months. Fortunately, there are things you can do to minimize these symptoms. Take your medication with food, unless you are told otherwise. Take your antidepressant at bedtime to sleep through the worst of the symptoms. Eat smaller, more frequent meals. Suck on sugarless hard candy whenever you are nauseous. Take an antacid like xantacronididine or bismuth subsalicylate like Pepto-Bismol. Sip ginger tea or slightly flattened ginger ale. Ask your doctor about a slow-release form of your antidepressant. Ask your doctor to temporarily lower your dosage. Your doctor can also prescribe anti-nausea medications such as Zofran and ondansetron. If your nausea or vomiting becomes intolerable, your doctor may have no other choice but to change treatment to another antidepressant with a lower nausea risk, such as selective citalopram Paxil paroxetine or Symbyax fluoxetine olanzapine. Drug tapering strategies. To reduce the risk of withdrawal symptoms when stopping an antidepressant, Speak with your doctor about the appropriate tapering strategy. Going cold turkey is never advised and may end up triggering the very symptoms you were being treated for. As a general rule, the longer you've been on antidepressants, the longer and slower the tapering period will be. Some people can be tapered off in a matter of weeks, others may take months. Most doctors will reduce the daily dosage in 3 to 4 stages, maybe more if you've been on a drug for a long time. Examples include Paxil8. Starting dose 60 mg. First dose reduction 40 mg. Second dose reduction 30 mg. Third dose reduction 20 mg. Fourth dose reduction 10 mg. Celexa. Starting dose 40 mg. First dose reduction 30 mg. Second dose reduction 20 mg. Third dose reduction 10 mg. Alleviate. Starting dose 20 mg. First dose reduction 15 mg. Second dose reduction 10 mg. Third dose reduction 5 mg. Prozac. Starting dose 60 mg. First dose reduction 40 mg. Second dose reduction 30 mg. Third dose reduction 20 mg. Fourth dose reduction 10 mg. Zoloft. Starting dose 200 mg. First dose reduction 150 mg. Second dose reduction 100 mg. Third dose reduction 75 mg. Fourth dose reduction 50 mg. Tapering should always be done under the supervision of a doctor. In some cases, tapering may require altering doses if an interim dose is not available. For example, you may need to take 40 mg one day and 20 mg the next.